Hello, my name is Nicola Boitis. This slideshow will cover parenthood, types of delivery, expectations and costs, both mental and physical, the rewards and consequences, the effects on relationships, and what it's like to parent in the 21st century. What factors need to be considered when deciding whether to parent or not? So there's several types of parenting. Adoption is one. Being a surrogate is another. A step parent, meaning coming into a relationship with children from your partner. A godparent, taking on the role of the parents if something were to happen, being that other parent figure. And a grandparent, because nowadays lots of grandparents actually play the parent role. So what factors need to be considered when deciding whether or not to parent? So first off, there are two types of deliveries for babies. There's two types of ways you're coming into this world. It is by natural birth or a cesarean, which is also known as a C-section. Natural birth can also consist of home birth, a hospital, hearing women, stories of women having kids on the side of the road, in the restrooms. A cesarean is best recommended to be at a hospital, in a sterile area where it's safe and clean, which would also be best for natural birth, but it also does happen. So what is to be considered? What to consider? First, natural birth. So sedated mothers or mothers-to-be women have complications of pushing effectively, and this can cause birth by doctors using forceps or suctions to remove the baby from the womb. And this can lead to cranial complications or injury to the child. As you can see, the picture up top shows just like a little diagram image of what a suction cup is used for and an idea of it. It's not common for women to be unconscious or to be in a twilight sleep during the birth of her child, to receive an enema, have their pubic hair removed, and to be given an episiotomy, which is a surgical enlargement of the vaginal opening as a matter of routine. So those are some expectations that or possibilities that can happen along natural birth. If you have a problem opening up, if you have a problem pushing, these are things to take into consideration. And then in the perfect world, you just have the baby, push it out, and it's done. So C-sections. So fun facts about C-sections. Half of babies are delivered via cesareans in Brazil. In 2017, about 1/3, which is 32% of all U.S. births, were delivered this way. And in China, there is a high percentage of C-sections for parents to have their children or child on a specific date. That can culturally be considered a lucky date. This basically means if they decide to have their child on a date around their birth period, their birth date, the due date of their child, they could pick a day, whether it be a holiday in China, whether it be an ancestor's birthday. A good example is when I had my daughters, I had twins. I was able to semi-pick the date of when they were going to be born, and it was in October, and they wanted to do October 31st. I personally did not want them born on Halloween, so I said, how about I come in October 31st, and we have them November 1st. Fortunately enough for me, they came October 21st at 36 weeks exactly. Healthy as can be via cesarean. So C-section complications. Women take longer to recover. This often are in pain. They can't take pain-reducing drugs if they wanted to breastfeed or needed help caring for their newborn. Examples being like if you're in pain, complications of the surgery, best recommended if you want to breastfeed your child, you can't take any medications that will be effective because whatever you take is going into your body is producing into your milk, and that's what you feed your child. There are not many resources, unfortunately, for women seeking emotional or physical support after the surgery, and it's mostly because women are shamed for not giving the attention to the baby, but a mother's self-care. Great example is you getting out of a cesarean and you're in pain and you just want to relax and you say, I just need time to just recover. But you're a mom, so people are looking at you like, you don't have time to recover. You need to take care of that baby. Women having children at older ages increases obesity, both of which increase the risk for mothers and babies. That's a possibility. It's riskier than a vaginal delivery for both mothers and infants. Experts express concern at today's high rate of cesarean births in the United States and around the world. Any type of surgical incision and removing a human is definitely high risk. So the rewards. Rewards on a cesarean is that if difficult births may require surgical intervention, so you're having a natural birth, and there's no question that the cesarean, you need to have a cesarean. It can be a life-saving procedure for both the mother and the infant, and that's reward for it. A healthy mom and baby, and the lives are saved. Perfect example, my baby A was okay to come out as a vaginal delivery, but baby B would not have made it. The chances of baby B not making it through the canal were high, therefore we went via C-section to keep both of them alive, both of them safe and out of harm. So the finances. The average American family to have a child in 2015 for a middle income family, the average cost of raising a child to age 18, one child, is $233,610. This consists of transportating, childcare, education, food, healthcare, and clothing. The average monthly cost of a licensed infant childcare in the United States is $1,230. Childcare has definitely increased 70% from 1985 to 2011. In a 2018 survey of 1,858 men and women ranging from 20 to 45 were asked why their ideal number of children desired has lessened, in which most consisted on financially affording children. 64% of those numbers said that childcare was too expensive, and 44% can't afford more children, with other figures and numbers in between, those being the main two. How does this affect happiness? Affecting happiness in your relationship. Survey data shows that not only do parents report lower marital satisfaction than non-parents, but also the more children they have, the lower their marital happiness. Some factors to take on could be a lower income, struggling financially day by day, difficulty with communicating, you and your partner don't communicate well, with baby's needs or mother's needs, being a new mom, being a new dad, complications or recovery from childbirth, parental anxiety and depression, post-natal depression, and father's depression, and the child being a poor sleeper. A poor sleeper baby basically is a child who doesn't have a good sleep schedule, doesn't sleep at night, so therefore you're tired, your partner's tired, the baby's tired and cranky, and causes a lot of chaos and drama. The drop in life satisfaction associated with having a child has been shown to reduce the likelihood of having another. You have one bad experience of having a baby, and if you're your partner, that has basically summed up the result of not having another. In planning for and incorporating a new baby into the family, is expected that changes will occur in the family system, and that the new mother and father may differ in their perceptions of what it is occurring in the family dynamics. That was an article pulled about expectations on changes. So how have these trends in parenthood changed? So nearly half, 45% of all pregnancies are unintended, and of these 60% were mistimed, meaning they wanted to have children, but it just happened before they wanted it to. 40% were unaware, and they did not want to become pregnant anytime in the future. Having children is seen as a meaningful aspect of a personal identity. 57% of wives and 45% of husbands with children at home strongly agree that life has an important purpose. 70% of high school seniors agreed that fatherhood is one of the most fulfilling experiences for a man, and 60% of women agreed that motherhood is the most fulfilling experience for a woman. So, no baby on board. Child-free, also known as voluntary childlessness, is a choice to not be a parent. Women can feel both grief on this decision and relief. They tend to put it off until society considers it to be too late. 70% of women in 2001 say no, that not having children takes away a complete life. More couples are satisfied with their relationship. They're more educated, have professional employment. They have higher incomes. Some couples just value the freedom, being able to change their jobs, finding new interests and hobbies with their partner. And statistically, elderlies who live child-free live with less stress and depression than parents. So what are the consequences or deep thoughts? So childlessness is toughest for people in their late 30s and early 40s, when some age peers are consumed with child rearing. Some women report feeling shame for being selfish, unfeminine, or unable to nurture. They feel left out during the holidays or family gatherings. Some individuals who do have children face an array of options and circumstances. Having children. So early birth. Physical being, able to have children. You set back on your career. You work harder to meet family expectations and needs. Later childbirth is a personal development in your career and in your partner and your relationship. You have more flexibility to balance work life and children activities. Possibly married to higher educational men. More progressive gender roles. And would more likely help around the house and with child responsibilities as the fathers. And fathers seem more patient. So what are the advantages in the 21st century? 2/3 are married couples. 24% are single mothers. 6% of these families include young adult children. You have the options of bottle feeding or breastfeeding. You have the options of circumcised boys, if you wanted to get your child circumcised. You have fathers that are more present and invested in the child. Fathers want to be involved with their infants and are eager to learn how to promote their child's growth and development in the best possible way. Technology for rearing. You have cameras, diapers, you have cloth diapers, you have natural made diapers, you have wet wipe warmers, you have an outstanding creative rockers. We have research and studies on what to expect when expecting books. Children have transformed from an asset to liabilities, meaning now they're more wanted for the beneficial reason than for an economical reason. So what are some challenges to parenting in the 21st century? There's more social awareness, as in discipline. It's hard to discipline. Society's taken away the rights of disciplining for children. Some people could take disciplining as abuse. The expenses of childcare. Money, money, money. Daycare cost me $275 a week for my 2 kids. And that was based only on hours of the week. Therefore, I couldn't surpass more than 40 hours of them being there. And that cost me $275 a week. You have 2-parent households, which different rules taken into consideration. You have mom's house, you have dad's house. Children don't have a stable home. You raise children in society with conflicts and values and points of views. Some situations, parents are caring for children and their parents. You have your mother who's sick or battling some type of disease, or your father, and you have a newborn baby that you have to balance both being a caretaker and a mother. And parents are responsible for successfully raising good children in this society. These are my references. I hope this slideshow helps you consider the options for childbearing or conception, and to really ask yourself, are kids for me? Thank you.